The government of Guinea had no idea how to respond. All previous Ebola outbreaks had occurred over 1,000 miles away. But the relief group Doctors Without Borders had decades of experience with Ebola. Within 48 hours, they set up a field hospital in the town of Gekadu, the epicenter of the outbreak. The first patients began to arrive.
Most of those cases came from different villages or different areas in the city of Gekadu. That's a very bad sign because it means that you don't have just one cluster or one family or one village that is hit. It means that it's already spread out.
Past outbreaks had shown that the key to stopping Ebola was to isolate the sick, monitor anyone who had contact with the infected, and safely bury the dead. This complex operation needed a level of manpower and coordination beyond the resources of Doctors Without Borders.
And I remember my headquarters asked me, like, what do you think? Is it 5 villages or 10 villages or 15 villages or more? And I remember I said, if I have to choose between those 3 options, I do believe it's 15 or more. And I said, like, I think we have a big problem.
The World Health Organization, WHO, is part of the United Nations and has a mandate to help governments coordinate their response to outbreaks.
We thought, okay, here is a disease that we have dealt with for a number of decades before. And, you know, in our own mind, we had the idea that Ebola was something which was severe, but typically occurred in a certain way and then could be handled. But at that time, we didn't really know how complex it was going to become.
The WHO left the response in the hands of its officials in Guinea, who had no experience of Ebola. They set up what would become daily meetings with the government of Guinea, Doctors Without Borders, and other aid organizations.
Those daily meetings were a nightmare. Every day, day after day. Disorganized meeting, no decision taken, no one knowing what they were talking about. WHO people were really not at the level required for the job. Their coordinator never worked on Ebola before, and WHO was really downsizing the scale of the epidemic. Immediately I thought, those people are useless. They don't even understand what they're supposed to do here.
WHO, although it's a very important technical agency, our powers are limited when we're operating in countries. The countries take the lead. We advise honestly, and this is what we try to do in Guinea.
The outbreak quickly spread 400 miles to Guinea's capital, Conakry. Doctors Without Borders' top Ebola expert spoke out.
On est confronté à une épidémie d'un type qu'on n'a jamais vu, une ampleur qu'on n'a jamais vue, par la répartition du nombre de cas sur le territoire.
The government of Guinea accused the group of sowing panic.
Le lendemain, j'ai convoqué toute l'équipe, le responsable de l'équipe Médecins sans frontières à mon bureau, pour leur dire pourquoi cette phrase, une épidémie sans précédent.
C'était spontané, je veux dire, ça me paraissait tellement évident que je ne me suis même pas posé la question de savoir si ça allait choquer les gens à X, Y ou Z. Hein. Non, c'était spontané, pour moi, c'était une telle évidence.
Moi, je ne connaissais pas leur vision. Ça allait prendre du temps. Mais si, de façon unilatérale, vous essayez pour faire des communications différentes à celles que nous donnions de façon officielle, je n'ai pas bien apprécié. À l'époque, moi, j'avais grand espoir, avec tous les dynamismes qu'on avait à l'époque. Mais vous savez, il y a quelque chose qu'il ne faut pas perdre de vue.
The Ministry of Health now ordered its teams in the field to include only laboratory-confirmed cases of Ebola in their death count.
Oui, mais nous travaillons, si le ministère de la Santé dit que c'est les cas confirmés qu'il faut déclarer, ça c'est politique. Ça, je ne sais pas quelle était leur vision de dire de prendre seulement les cas, parce que certainement le nombre de cas probables, confirmés, suspects, ça allait grandir Et ça allait effrayer le monde d'affaires de venir dans le pays. Il a dit, ah, il y a